All right, time for the SMX medical update. We bring on the good doctor, Dr. Joe McGinley, who will be on hand at Redbud this weekend. More on that in a bit. We're going to talk Chase Sexton's situation here, though. Unfortunately, it appears he is now lost for the rest of the season, including SMX World Championship and playoffs with a torn ACL, with that crash that everybody saw on press day at Thunder Valley. I feel like we talk torn ACLs here all the time, Doc. And honestly, the riders bounce back so quickly. It almost seems like a nothing burger these days, even though it used to be a devastating injury. Is there any worry or concern there, or they have this buttoned down so well that this is just expect the same Chase Sexton to be back when he's healed up?
When he heals up, yes, I expect the same Chase Sexton. He'll be at his top form, ready to go for round one of Supercross. Yeah, the recoveries are being accelerated, that's for sure. I mean, shortly we're going to be talking about riders coming back in a week or two at some point.
Yeah.
It seems like it's happening so quickly. But yeah, the process, the reconstructions are better, especially for athletes getting them back on the bike. But where most of the progress is being made is after the surgery itself, dealing with the patient and not just saying, okay, go home and stay off it for 6 months. The active recovery that we've mentioned in the past, recovery no longer is a passive thing, it's active, and there's lots that you can do to accelerate the soft tissue healing, get everything, the inflammation down, get range of motion back, get strength back. Yeah, we're seeing riders back on the bike, at least on turn track, sometimes in 3 to 4 months now after an ACL injury. Unfortunately, that's still past the finals and the playoffs. So, Chase is going to be out for the rest of this season, but I expect him back for round one at Anaheim at full form and ready to go.
Can you tell us some of the specific things? If this was me, 2011, having knee surgery, what would you be doing if I flew to Wyoming to the McGinley Clinic and said, hey, I need every single day to be shortened to get me back on the motorcycle? Where would we start?
Yeah, so first we would assume that you've had it repaired and reconstructed, so the surgical reconstruction is key, and that technology has advanced as well. After that, as far as where we get involved after the surgery, cell therapies and biologics are the key to accelerated success. We're seeing it with riders across all areas of motocross, but especially at Club MX. With the racers we're working with there. A lot of stem cell treatments, PRP, exosomes, growth factors. These things are just doing some amazing stuff for these riders, getting them back out, healing the tissue, healing it stronger, healing it faster. And one of the biggest things with the newer biologics that we have access to is decreased inflammation. So with the exosomes and growth factors, we're seeing accelerated inflammation reduction, which allows for earlier return and earlier range of motion. And then the cell therapy helps to heal that tissue faster, so you get a stronger reconstruction, a stronger healing of those tissues. So when you're back out there, you're confident in that process. And then from there, JT, there's a whole bunch of other things that you can do to facilitate that. There's obviously cold therapies, heat therapies, lasers, ultrasounds, shockwave therapy, all of this stuff, working with therapists, chiropractors, everywhere, athletic trainers. This really is accelerating recovery after we're done with the intervention. So it's a stepwise process, beginning with surgery, then aggressive cell regenerative medicine therapies, and then all of the other anti-inflammatory and range of motion therapies afterwards. So the process continues and gets you back out there a lot sooner.
We'll see you on the weekend. Good to chat.
Thanks, guys.